medication.
McDonald's, Coca-Cola.
Yeah. Nope, that's Diet Coke. Make sure the scribe gets that correct. Diet Coke.
Oh, diet. Yeah.
And then Mr. Biden talks about his ice cream habit. Those things aren't going to make their way into the general public perception.
Welcome back to the Gillett Health podcast, where we give you tools to develop a balanced approach for health. I'm Dr. Kyle Gillett.
And I'm James O'Hara, nurse practitioner. And today our hook is what the president's physician is really saying, or saying without saying. And that is that the president has less than 10 years to live. So explain to the audience why I came to this conclusion back in 2021.
We've discussed President Biden and President Trump's health stacks and publicly available physicals. We'll actually put these links in the description for people who are curious. And what labs they had. For example, Trump had a PSA, Biden did not have a PSA, but the presidential physician during the Biden administration, I suppose, admitted, that would be technically correct term, because this, they are documenting on a medical record that there is no need to screen for certain things at certain ages if someone is not expected to live 10 years.
Yeah. So if you look into it, there's a couple of ways. If you look at just the PSAs, Trump gets a PSA checked. His physician thinks he's going to live 10 plus years.
Correct.
Biden doesn't get a PSA checked or doesn't have it listed on the report because it's bad. And his physician doesn't think he's going to live 10 years. I suppose if you're playing the kind case, you could say, well, this physician is just following the USPSTF guidelines and not checking it because he's over 70. You don't check PSA over 70. Right?
Yeah, I often do. But the other thing about Biden is he also gets labs like a homocysteine. You're not supposed to get
the USPSTF.
If it is, they would recommend against routine checking of homocysteine and vitamin D and things like that, and CTs of the lungs. But there's a pretty glaring error there, because he also had orthopedic evaluation.
Yeah, I thought that was particularly interesting, given the recent news of the bone mets. Perhaps that contributed to his difficulty with walking. And 2021 and was it 2023 as well? I believe they mentioned these orthopedic consults, the blood work, the physical, and the 5 hours of exercise he does per week, or 2 hours of exercise per day, something sort of exaggerated like that.
Yeah,
maybe that's what he was prescribed. Adherence is a little bit different. We even talk about this with Trump's physical, where he was taking a statin, definitely taking a statin, but his LDL was 143.
Yeah.
And now he just added ezetimibe to that statin, and it's dropped substantially.
Correct.
Look at last month's results. So I think they had to talk with him about compliance, and that seems to have done well in terms of LDL lowering. But unfortunate news for Joe Biden, and of course we wish him well, but it does bring up this debate about prostate cancer screening. Who should you screen? Do you just let this happen to elderly people? And like yourself, I check people based on their health status, and I don't think I have any patients currently that I expect to die within the next 10 years.
Yeah, it's certainly possible that they did a shared decision-making discussion with President Biden when he got his presidential physical, and discussed the risk of false positives, unnecessary biopsies. And he could have said, you know what, I'm busy this year. I just want to put it all off into next year, so I defer this. Although you would expect that to be put in the note. Yeah,
and I think that certain things are not going to find their way into the note. Let's imagine you're having this discussion with either presidential candidate, and you're like, what's your diet like? And that's going to be part of any health evaluation.
McDonald's, Coca-Cola.
Yeah, nope, that's Diet Coke. Make sure the scribe gets that correct. Diet Coke.
Oh, diet. Yeah.
And then Mr. Biden talks about his ice cream habit. Those things aren't going to make their way into the general public perception.
Yeah. Unless you're at a lifestyle medicine clinic where you're seeing a dietitian. Should they make important public figures see dietitians or sports dietitians if they're healthier than the country is presumably healthier.
Yeah, it'd be interesting to see. I mean, compliance is always the question there. You can tell people what they need to eat and stop eating their ice cream, but they may just say, I like ice cream. I don't care if it contributes to health problems, whatever it may be. I'm just going to keep doing it. Or they may take it seriously. And, supposedly, Trump is down some weight. His blood markers look a little bit better in terms of the lipid profile. I don't know if that's diet or just additional medication that was added there, but something has changed. So I guess he is more open to some feedback.
Yeah. I think it's interesting. And, perhaps one good public takeaway is if your provider's not ordering a PSA on you, ask your healthcare provider if he or she thinks that you're going to live more than 10 years. And then if not, why not?
Yeah, it may be an uncomfortable conversation. And that's a thought I had is, did they already know about this prostate issue and they just sort of had that redacted or didn't put it in the report, or were they just not checking it? Because I think it's possible they knew in 2021 that he had, maybe a prostate cancer that they were just, following with active surveillance. Maybe at that point it was a low Gleason, and
maybe that's why he said he wants to redo the cancer moonshot for the VA.
Yeah, 2022. So 2021 he has the physical. 2022 you see these cancer things, and then it was called what was that? It was the Veterans Prostate Cancer Treatment and Research Act that same year.
Yeah,
so
great.
Timing-wise, if you want to look into when would he have potentially known, maybe 2021, 2022. And the story that is sort of being spun now, and we talked about this in a clinic, like you don't go in, get a digital rectal exam, and then a few days later know that, it's this Gleason and it's sensitive. It's a hormone-sensitive cancer. That process takes weeks to even a month to get those results back.
Yeah.
And if you have a routine examination, how is it for symptoms? Because I think I saw that headline. It's like, this was found on a routine examination. Something
because
about
of urinary symptoms.
Yeah.
So usually you would think you're looking for BPH if it's urinary symptoms. Yeah, it's a very interesting story, and perhaps it's not 100% correct because it's
the reporting. Yeah,
it's pretty classic. However, it is interesting that people are saying, oh well, maybe this 80-year-old person should have known that they have prostate cancer. Keep in mind that, like you mentioned, if he did have a very low grade that was doing active surveillance, that's not a clinically significant thing for most people because 50% of 80-year-old males have a low-grade prostate cancer, but only 3% of the time or something like that is it actually going to affect them.
Yeah, and this brings up the question of transparency. So should the American population, the rest of the world for that matter, know the intimate details of their president's health? And from a power and vulnerability standpoint, you could say no. But from a the truth is always better standpoint, you could say yes, people should know about these things.
We definitely should eventually.
Yeah. Well, I think if they let this through, right? So they have someone who, a lot of people in a lot of instances of cognitive impairment seem to be happening.
Yeah.
They released a report showing he's taking 3 different antihistamine medications, right? A nasal spray, Pepsid for reflux, and then I believe it was, Claritin, Zyrtec, something like that. It's you let that through, and that doesn't take a rocket scientist to figure out that, hey, antihistamines are not great for people that are 80 years old.
Yeah.
But you're not going to...
And tripping and falling.
So that's where the line is. It's okay, we'll allow this through, but something like cancer, which is a scary word, they're not going to let that through. So right now, I think that's where the line is, and I think I agree with you that long-term that line is going to go more... It's going to become more inclusive of the health conditions there.
Yeah. Yeah, maybe all the medical records should be released after they exit office. So if there's something that, they're working up that potentially could put the country into a state of weakness, then you wait until after. But that way you're not trying to hide it indefinitely. For example, with John F. Kennedy, his main physician has still not released the lion's share of his medical records, but we know a whole lot else because we basically know things from every other source.
You mean they didn't release his full physical? exam reports in real time during his presidency?
Definitely not.
What? They didn't put the methyl testosterone and 100 milligrams or 100 micrograms. That was almost a funny typo we had in the copy paste we had.
Yep.
25 micrograms twice a day was the dose he landed on of T3.
Yeah.
But they experimented with up to 100 micrograms. And this is from like a deposition hearing. So, who knows? It could have been potentially higher.
Yeah. A pretty interesting case for a podcast another time. But he's also a good example of the advancement in modern medicine, because many people with Addison's disease would die, whereas he fortunately had, the pharmacology boom after World War II when they developed cortisone. He was one of the first people on oral cortisone. So he certainly benefited from that quite a bit. But I think that we can learn a lot from how we treat presidents' health and also politicians' health. I think that in general, if you're not sure if you should be open, honest about it or not, you should be open about it, and it should just be released. Because if anything, we need to realize that there's a difference between a very healthy 70 or 80-year-old and, in my opinion, we have way too many very old politicians with very poor health.
Yeah, that's undisputable. If you look at the average age, the median age of someone in any Congress or legislative branch, they're very old. And I presume it's a lot of younger interns that are making the bulk of the policy, and then they're just making the high level or not so high level decision making.
Yeah.
But I think if you go back historically, probably with let's say Kennedy, right? He was getting the cutting edge of like, hey, this is the best of medicine and even some functional medicine.
Yeah.
Right? We had some B vitamins he was taking, some vitamin C that is
injectable vitamins.
Yeah,
Yep.
his doctor sprinkled in there. And then you have, again, I haven't looked into this, but apparently Eisenhower had a mismanaged heart attack, right? Where they found out he was having some stomach pain, and they're like, oh, it's reflux, GERD, whatever.
Oh my.
He was hospitalized. They played it off, and like a year later, he had a stroke, right? And they were not transparent with that. And it doesn't sound like he was getting cutting edge care. And I think it sort of varies, right? I don't think that either Trump or Biden was getting cutting edge care. I mean,
definitely not.
Get better care from probably your average concierge medicine clinic, where it's like, really, you're 80 years old. Let's see if we can scale back some of these antihistamines. Or, Trump, he's on rosuvastatin and ezetimibe, which is a perfectly fine combination for lowering.
Decent.
But I don't know if he's had even a calcium score or a CCTA or a carotid ultrasound. And maybe he has, but if the presidents were really getting like the best of the best, regardless of cost, like Repatha makes a ton of sense to be used in that situation instead of rosuvastatin, for example.
Yeah, that's a good point. And, obviously you have to let individuals have some degree of choice with their physician, but there's so many good ones to choose from that would be happy to, invest a good amount of time into somebody like that. So
we actually would like to thank the Trump team for taking our suggestion and adding ezetimibe to his regimen.
Yeah,
pretty sure we did make that suggestion.
It is funny that we suggested that and they included that addition. So
where it might be different is the imaging and the procedural stuff, right?
Yeah.
So even if one of our patients has something and they need to get imaging, like they can't get it same day or next day a lot of times. If it's something where they're in a rural spot and need to get to an MRI scanner and they're booked out.
Yeah.
But if you're the president, I think you do get moved to the front of the line.
Yeah.
That's probably the true advantage that they have.
Yeah, there's definitely some degree of privilege with that. And even being a healthcare provider and just knowing where the different options are, there's some degree of privilege as well. I think that's a pretty good summary of Biden's health update. It's really nothing too shocking or groundbreaking other than the timing of it. If this was 3-4 years down the road, I don't think people would be saying, wow, it's really surprising that he has metastasized prostate cancer at this point.
Yeah. I mean, at his age, like you said, prostate cancer is probably an 80% possibility. Like, 8 out of 10 guys are going to have it, even if it's microscopic. But with the mets to the bone, that's really unfortunate.
Yeah. So obviously we wish him and his family the best of healing and whatnot, and hope that this, pop culture item will incentivize more people to do cancer screenings and early detections of any type.
Yeah, I think that's a great takeaway. Even if you're not a president, you can still take presidential care of your health, staying on top of routine screenings, which I think only about 5% of the population does. These are things like a PSA or an A1C or a colonoscopy. Yep. Those are the really low-hanging fruit, and that's where health optimization can start for a lot of people.
Yeah.
So let us know if you're one of the 5% in the comments below. Let us know what you think about presidents, any of them. Pick your favorite. And thank you for your time. Thank you for watching. May God bless you with health and happiness.